Nice.
Yeah.
Welcome to the Grappling with Podcast. Dr. Chris Hardy and William Walker will take a deep dive into topics covering wellness and prevention, performance, recovery, and injury management.
Okay.
Our mission is to provide the latest science-based information to help you get the most out of your grappling journey, both on and off the mats, and help you overcome any challenges you may be grappling with. Dr. Hardy is a licensed physician and BJJ practitioner, but the contents of the podcast are meant for educational purposes only and should not be taken as medical advice. Please seek out personalized care from your own medical provider prior to implementing any medical treatment or intervention.
Just throw it out.
Anyway, we're coming in hot.
Literally.
Yeah, I was trying to turn off this thing.
We got a sauna going in here.
Yeah, that's all right. It's cold and terrible outside.
Yeah.
It's like November here, and it's really May.
Yeah. If you see sweat drops, I didn't just take some Molly. I am just warm.
I want to watch you sweat after all the comments you made about me sweating. So
That's true. Well, the whole gym talks about you that way.
now,
Yeah.
thank you.
Yeah. Here we are for episode 19,
Yes.
and I got some stuff to get out of the way.
Oh, here we go. Okay, let's do it.
Nothing crazy, but if people could make some reviews on Apple Podcasts, if you happen to listen to this on Apple iTunes, throw a couple stars on there, preferably more than a couple. 5 stars only. If you do less than that, I hate you.
Can you track them down?
Yeah.
Okay.
I have that capability.
Sweet.
I thought you were going to say something about how guys need to wear shorts over there.
We'll get there.
Okay.
And yeah, we'll get there. So, yes, if we could, if you want to help support, that's a way to support, is doing that on iTunes. I think Spotify might also have a way to do some sort of rating. Also, just telling your friends, peeps, friends, and family that at your gym, you just turned off the heater.
No, it's the... Never mind. Okay.
We're running a tight ship here.
Yeah,
dude.
we are. We're doing a Saturday podcast. What's going on? You
Nothing.
just say it.
The light's not showing.
Oh, like this light?
Yeah.
Okay.
You have a black wall behind you.
Well, that's my life.
Okay.
Yeah.
So,
It'll probably for
I
the
didn't know if that was what you were going for. Or...
oh no, I don't. Yeah, it's
he's
fine.
doing the whole Jocko thing.
Yeah, I am.
I like it.
Good.
Good.
So we can see your face very well.
Okay,
So-
good. So that's one thing. 2 is I think I made a post about, well, Tom DeBlas I think made a post about wearing spats, and dudes specifically wearing spats and no shorts over those spats. Spats are like leggings, right? And I put that on my Facebook, and I got more, or Instagram, I got more response from that than anything I think I've ever posted. People were just like very supportive, because it was like, please, if you're going to train and you're going to wear spats, wear shorts over them, especially if you're a dude. Especially. What are your thoughts?
Yeah, I think, coming from the medical profession, I don't want to see stuff like that typically outside the office.
I believe the technical medical term, we have Carrie here in
Is
the
package?
back. No, I believe it's junk is one. I believe moose knuckle is the other. Male camel toe. We don't.
No, it's just
Nobody-
not. No. I'm. It's 2 thumbs down for me, for sure.
Yeah.
I agree.
He's all bulgy like a moose, and we just don't need it.
Yeah.
And then literally that weekend, I go and I gym drop someplace, and there was a healthy male with just spats.
Yeah. It's a problem.
Light in the ass, had a weak caboose on him, so his spats were even coming down a little bit.
You were really checking it out, weren't you? I mean,
He
you
was
had.
up in there.
Okay.
I was examining. So I'm just saying, PSA, is that a public
service
Yep.
announcement. Yeah.
Put some shorts over your balls.
I'm down with that.
Okay.
Yep.
Also, I want to get a question that we received and I totally missed a couple weeks ago. And I want to just get it out of the way and get it addressed right now before we get into our subject.
Excellent. Let's do it.
Livy,
Yes.
hit it.
Okay. Do you think training power or explosivity, I'm saying that wrong, for jiu-jitsu is as vital as it is for other combat sports?
They said power or?
Yeah.
Kind of the same thing. So power, just to kind of review, it's the ability to generate force over a time. So the more power it is, a lot of people think power is strength. Perfect example, powerlifting versus Olympic lifting. The ironic thing is powerlifting is not a power exercise and not a power sport, where Olympic lifting is a power sport. Power is moving weights quickly or generating force quickly. Strength that doesn't have that time component to it. So Olympic lift, like a snatch or clean, very quick movements. Explosiveness, you could think the same thing, fast twitch muscle. And so just to kind of clarify the terms, if we're comparing it to like other combat sports, like MMA, I'm assuming,
Boxing, kickboxing,
MMA especially, I think power training would be more useful. Not that it's not useful in jiu-jitsu. I don't think my personal opinion, I don't know how much of a direct carryover that would be. We do have periods of, kind of where, you want to move quickly and explode, but not to the degree that MMA requires that.
Yeah, or like kickboxing, let's say.
For sure.
I mean, just to have those quick strikes that have power behind them.
That's right.
It's going to be pretty beneficial.
Well, and that's right. And so I don't think if you were to use your time off the mats with training exclusively power, you could certainly mix it in. But I don't think that wouldn't be the time best spent, as opposed to like kind of really working that isometric strength endurance type of thing. I think would apply better, in my opinion.
Okay, so there's the stuff that like the Marinoviches were doing with BJ Penn, right?
Making them fast.
Right. And so would you say that kind of training is more beneficial for your kickboxer or striking art, let's say?
Yep.
More so than just straight power lifting.
Yeah, or even high level wrestling where we're doing they're doing a ton of the blast doubles and whatever, where you're using it more frequently.
A lot of bands with that kind of stuff.
You can. That's a way to do that, right? But just generating force quickly, I wouldn't want to bias my training to that for jiu-jitsu necessarily. You could add some in, but I really would work kind of a slower gear. Just my personal opinion on that.
For grappling.
For jiu-jitsu.
Okay.
Yeah.
Okay.
Yep.
Well, I think that was a nice, quick and easy answer. Thank you for the question to whoever asked that. I know who you are.
I think it's actually mad that it wasn't answered, right?
Yeah.
Okay.
Probably. It was your fault, I told him. So he doesn't answer those stupid questions.
He realizes I barely can use email, right?
No.
Okay.
So it works out for me. So what do you got for us today?
I thought we would talk about just some general principles on injury management, specifically like soft tissue injuries. I'm not going to get into broken bones or anything like that now, but like tendons and ligaments and things like that. I mean, many of us will pull something like, dang it, I strained this or that. But the principle, so I'm going to outline, I actually want to do something maybe a little severe, like you've torn a tendon or a muscle tear. And I'm going to kind of use myself as an example because I did that over the last summer to kind of how I approached it and how I was able to get back on the mats, not only sooner than normal if I would have done kind of the standard, what was kind of, always told to us, is for injury management in the medical and the physical therapy community for a long time. But also not only that, but not only coming back in a shorter amount of time, but being more resilient after that injury, so I'm not worried about re-injuring it. Okay, so that's really important when we talk about repairing soft tissue and how that works. Kind of what the old dogma was. That's kind of being shoved to the side, but it still persists. If you go ask your family doctor, unless they're really up on it, they're going to give you the kind of the same old thing that we've always, which really isn't appropriate.
Rub some steak on it. Here's some Tylenol.
Yeah, yeah, exactly. Well, that really wouldn't, but yeah, something like that.
I've rubbed a lot of steak on my inner thigh.
Have you?
Yes, because I used to pull that muscle, that inner thigh muscle.
Okay, I gotta ask, what was the rationale behind it? The steak?
The steak?
Yeah.
What was it? It was a movie called The Sandlot, and the kid couldn't catch the ball when his stepdad threw it to him. Very nice scene.
Okay.
And it hits him in the eye, and his dad throws a steak on it to, I think, prevent the swelling.
Because the steak was cold, I'm assuming.
It was, yep.
So it's more of a cold
yes,
thing.
I always use cold steaks. And because the warm ones bleed a little too much. Made that mistake once.
And they probably aren't cold.
Also that. So what I do is I usually tape a couple T-bone, yeah, or ribeye to the inner thigh.
Okay. You still do this?
It's been a while because I haven't got hurt in a while.
Okay. Do you eat the steak afterwards?
Well, I put it back in the freezer, of course, and then I will later.
Okay.
Yeah, I'm not gonna eat it like off my leg.
So then, well, I mean,
That's ridiculous.
I think it's ridiculous too. So it's not like the next holiday you bring it out. Let's say you have family in town and you're gonna bring out, hey, look, I got some nice T-bones here. By the way, they're on my thigh, and they're.
I mean, I don't tell them.
Okay.
But I mean, if one happens to get in the mix,
Okay.
a little extra blessing for them.
So that's part of our the old paradigm, the whole rest, ice, compression, elevation.
Okay.
That was kind of the
This is a popular acronym.
Yeah, with trainers, physicians, physical therapists. For a long time, that was kind of what you do for an acute injury. Rest and put some ice on it.
Mm-hmm.
The compression elevation isn't necessarily very egregious, but the first two aren't the best, and we're going to talk about that. Before I want to get into that, though, it's really good to understand what's going on when you do injure a tendon or a ligament, and you do have a tear. And sometimes the best way, at least external, for tendons to know if you've actually torn one is you typically get some bleeding under the skin, subcutaneous bleeding, the bruising that takes place. You probably saw what my thigh looked like.
Yeah.
Looked like a horror show, right?
Yeah, it looked like you spilled a bunch of jelly under your skin.
Yeah, it was rough.
It was
Grape jelly.
Yeah, really wide spread.
Yeah.
It wasn't like a small circle or anything like the normal bruising that we might get.
Right from an impact. Yeah,
Mhm.
This was bleeding from the actual tear, and I tore my adductor, one of my adductor group muscles, which
see it.
you can't really see it right now. It's repaired, but that basically a lot of people call that the groin muscle, the squeezing muscle that we use to maintain closed guard.
Okay.
It's kind of pretty darn important.
If you see that kind of bruising,
Uh-huh.
is because it was pretty gnarly.
Yeah.
It was, I mean, I would say halfway down your hamstring and almost around half your leg.
Yeah.
If you see something like that and you don't have a physician or something in your gym, like, should you go
Yes.
and get checked out?
Yeah. And let me preface this. I'm talking about general principles here.
Mm-hmm.
Injuries can be varied and different degrees of severity. This isn't in the place of regular medical care and actually getting a diagnosis. Okay. That's important too. Especially if something's like, especially if you see something that looks like, okay, that's really bad.
So that under that large bruising, that go get checked out.
Yeah.
Okay.
Oh, absolutely. Yeah. So, I'm not telling you guys, hey, you guys can just manage it at home. I'm just saying once you have a diagnosis and, have a pretty good idea, you've torn something, or a really bad strain, for instance, even if you don't get the bruising, but like you could just, you may hear little pops or something really isn't right, and you can't really activate that muscle. I just want to kind of go over what really happens on a microscopic level and the time frame, because it's kind of important. So I'll put on my old dude glasses here.
Nerd alert. Nerd alert.
I know.
We got to get a sound for nerd alert, like a little siren.
Yeah, we should.
Yeah.
Or someone sounding like a nerd.
Nailed it.
I know. So the first thing that happens with this is you get this acute inflammatory phase. Everyone knows what inflammation is, right? The immune system generates an inflammatory response. At the site of, and we'll use me as an example, at the site of that muscle tear, muscle/tendon, because I believe I tore it right where the muscle becomes a tendon. Just to review, muscles then become tendons, which the tendon actually attaches to the bone. That's kind of the anchor for the muscle. But at the site where the tear is, what happens almost immediately is you get this big inflammatory response. And you actually get these little blood clotting going on around there. And it serves as almost like an initial scaffolding for the thing to start repairing itself. So it's like a bunch of blood clots filled with fibrin and a bunch of other things that are bridging that area to try to, again, to form. It's almost like we're creating a mold before we pour the real stuff in.
Mm-hmm.
That lasts, for 2 to 3 days, sometimes up to a week. And then we have what's called the proliferative stage, or kind of a repair stage. At that point, that little clot is already there, kind of a little bridge in the muscle. And then these things called fibroblasts come in. What they are is they're basically cells that make connective tissue, basically.
Technical term.
Collagen, stuff like you probably heard of collagen.
Well,
Yeah,
like
fibroblast is just the name of the cell. It's a type of cell. There's trillions of cells in our body.
Goofy-ass names you medical people have. And
We do it for a reason. So we can
blast.
Yeah, blast. Blast means to make. Clast means to destroy. We have the same thing for bones too, called
Am I saying it wrong?
blast. BLAST.
Okay.
Yeah, don't side eye me, man. Dude, well, we have to make up terms to sound cool.
Right.
And so we seem really smart when we're probably not.
You nailed it.
Yeah. So,
Okay.
most of medical school is learning this terminology
Right.
and all that stuff. But we have to know what we're talking about. That's why we name all these things.
Mhm.
So it's a type of cell that makes connective tissue, especially collagen. So it's recruited. We've already formed that kind of little bridge of clot. Those cells come in to start laying down material in the form of collagen to kind of, get that area repaired. And that can last from anywhere from, usually like 1 to even 6 weeks. And these aren't just hard lines in the sand. There's overlap between these phases, okay?
Depending on the person and all.
Yeah, and so many other things, which we're going to talk about. So that the fibroblasts start laying down collagen to try to, basically rebuild this damaged area. And those of you that are very familiar with, like if you cut your skin with a knife or whatever, the scar, that's what that is. It's, you get a scab initially,
That's
the
what
bleeding.
I was picturing is it's like basically just the scarring process.
Yeah, it's exactly right. It's the same type of process, but doing internally on a tendon. That's right. The same type of things are involved. And then you start getting, and this is all driven by the inflammatory response. It's even called, inflammation to proliferation. And then there's a long period afterwards. And this is going to become relevant when we talk about how to prevent another injury and some things you need to do. The last phase is called the remodeling phase. And believe it or not, that can last, and again, there's overlap from the proliferative phase, the repair phase. But that remodeling is a constant breaking down and rebuilding process, kind of getting that thing stronger and stronger. That can, believe it or not, last for years after initial injury. So, you hear people say that, oh, I've re-injured that same thing. I've injured it before. Mm-hmm. Oftentimes there wasn't adequate, it wasn't treated correctly and allowed to heal in the best manner possible. Mm. So those are kind of the main 3 phases that the body goes through during that.
Any way to identify when you've healed?
Yeah, so that's it.
Appropriately.
Right. And it's kind of an average, right? Some people, if you have underlying issues, especially people like diabetics, will heal a lot slower. There's reasons for that, and it's mostly due to blood supply, because especially in the extremities, diabetics have compromised blood supply. And so they just don't heal as well. But in general, these are just general markers. So, after the first week, for sure, you start getting probably into the building phase or the proliferative phase, where you're starting to lay down material. And that's the point where we want to start acting. So previously, they said, oh, you injure something, we need to rest it, right? Or even worse, okay, we need to immobilize that area, with splinting or whatever. There's a time and place for that, like post-surgical, if you're trying to make sure repair heals. But in general, it's not a good idea. And we'll talk about why that is, because during that phase, after about the first week, you actually want to start mobilizing that thing. And I even started mobilizing mine probably 3 or 4 days afterwards, meaning moving the thing. Okay, not under load. Okay, but creating movement, because when the fibroblasts are laying down their connective tissue, their collagen, first of all, the type of collagen they lay down initially, you guys don't need to know this, but I'm going to throw it out there for nerds. Type 3 collagen, there's a bunch of different types of collagen, but it's usually a little smaller. It's weaker than the type 1 collagen that's typically in most of these tendons and ligaments that we have normally. That will eventually be remodeled over time into type 1 collagen, but at that point, as it's laying down, we need some type of line of force, even very, very small force, directed on that area to kind of guide how it's going to lay down. And optimally, if you picture in your mind a muscle, there's a direction of pull. There's a direction those fibers lay, right? Like train tracks. And you don't want to start laying stuff down the wrong way, perpendicular to the track or whatever. You want to lay that stuff down right along that. And the way that happens is a process called Mechanotransduction. All that means is force is telling it, guiding it how to lay that down. So if you just sit there and immobilize tissue, it has no direction pretty much. And it just starts slapping stuff down.
So will this principle also be good for maybe not someone in jiu-jitsu that, popped their elbow in an arm bar and that was like the ligaments getting moving around, but just someone that was lifting weights and strained a pec or something like that. Or, someone that runs a lot and their hamstring got tight or something like that, like the movement thing.
Yes. This is a general principle for any type of injury, especially if you're trying to return to a sport.
I remember a couple of years ago, Russell Wilson, former Seahawks quarterback, he had some sort of leg injury. I don't remember if it was knee or ankle, but he came back quickly from it. And one of the things that people were like, oh, he's crazy, because he was putting out there that he's rehabilitating it all day. And part of that was because there was a bunch of pundits that were like, he needs to rest and stuff like that. But he was like, no, I'm working this thing, like not work as like lifting weights on it or something, but he's doing a lot of movement with it the whole time.
Exactly. And this is a principle called early mobilization, right? And it's really important. Even if, and you can do it too, like when I did, you can just picture my adductor tendon, those are the things that squeeze your legs together. So what I started doing so this was my right leg. You can have to picture this. It's kind of hard. My right leg was involved. So it's the inside of my thigh, basically, where you can squeeze your thighs together. So that side, and we call that the medial aspect of it. The lateral is the thing you can see on the outside, right? So since this was my right leg, I laid on my left hip on side. And I did
to rehab it.
Yeah. But this is the first thing I did to mobilize it, just to keep movement going. Okay. I would then open up my legs using that opposite muscle, the abductors, just to create a little bit of tension, minor. And when Carrie was watching me do this, and I'd do it a little too far, I'm like, oh, it would hurt.
So you're just laying on your left hip, and then you're
opening it up because I wasn't activating the muscle, but I was moving that muscle passively using its opposite. It'd be like if I hurt my bicep and then I was just doing tricep, just slowly opening,
using other muscles to really control it all, but that one's
to provide some type of, and you got to be real careful with it. So, at first using the bicep tricep example. So, if you injure your,
just an excuse.
Oh, to show my tricep.
Just an excuse.
Okay, come on. We have established at the gym
that Rob has the best triceps.
Yeah, but
in the gym.
But for an old guy, but I'm second.
I mean, no offense to Carl, you did beat Carl out because he's part of the older gentleman group.
Yeah.
50s.
Yeah.
Yeah. Good
So,
job.
well, I'm just saying. Can we use this? Is this going to offend you?
I mean, I might roll my sleeves up, but I mean, go for it.
How
Don't
could you
even?
Oh, okay.
Don't look at them.
I actually thought that was a string, but I see it's your arm.
No, that's
I thought you had
vascularity.
Oh no, I thought you had a little string hanging from your sleeve. I was going to try to clip it off, but I'm recognizing it's your arm now, so I did.
Every episode we talk about our arms.
We're super insecure.
We are super insecure. You should see this new lifted truck I bought. It's pretty dope. F-350.
You did not.
No, I'm talking. It's a joke, like dudes with big trucks.
Oh, I know, but I didn't know if you actually did it. Who knows with you? I think we're done on this podcast.
Keep going.
All right. So let's use this example if you can handle it.
I'm staring.
Okay. So if I had injured my bicep here,
Mhm.
I'm not going to use my bicep to actually activate that early on. So about 4 or 5 days afterwards, I started providing a little bit of tension using the opposite muscle just to open as far as I could. Then I'm like, and it was kind of rebelling. It was like, oh no, we don't
But
like
you will
that.
stay away from doing
Active. Yes.
okay.
Yes. Not that early.
Yeah.
But I was providing a little bit of line of tension because as I open up here, this muscle is providing a little bit of stretch, right? Because this is where the bicep is shortest. This is where it's longest. So I was using the tricep to open up the elbow, providing a little bit of tension there.
where's your stopping point? Pain,
Yes.
stretch,
Pain. And then, matter of fact, the nervous system was like, I went into spasm.
Okay.
My adductor.
Mhm.
And so then I would stop and I wouldn't go that far, but I'd open up just a little bit and I'd keep that line of force going. So as this stuff, the fibroblasts were working, they had a clear direction to start laying this stuff down.
Mm.
So this early mobilization is super important. I was also doing isometric work.
So how early were you doing this?
So at about the 4th or 5th day. So obviously when a pretty severe tear, when it's super inflammatory and that blood clot bridge was starting to build, you don't want to be messing with it too much, right? You want to kind of, at that point, you do want to rest and really protect it. But that's only for like 1 to 3, like 3 days at the most.
And that was a pretty severe injury.
Yeah.
As in the actual tearing. That's what you had all the blood underneath.
Yeah.
What if it was kind of the more generic, I would say, injury that whether it's people lifting weights or specifically jiu-jitsu people get, and that's where we get a couple pops on the old elbow.
Or you get I strain my hamstring, but there's no bleeding or
I have
something
my
like that.
thing, what were you calling that? Where it feels like almost rotator cuff pain,
Yeah.
but it's that nerve that.
Actually, that's yours is different. That's a fascial restriction you have going on there.
So maybe not as severe
Mhm.
as the tearing that you
Right.
have with bleeding and all that. Can they start doing this kind of activation
Right away?
Right away.
Yep. Because remember, any kind of strain, like, oh gosh, I pulled something, even if you don't see obvious bleeding, at the microscopic level, you still have tearing of that.
Okay.
There is, but it's not enough to disrupt the vasculature and then rip the blood vessels and cause bleeding. But you do have some muscle fiber.
Mm.
As a matter of fact, every time you work out and lift heavy,
Right.
especially the negative portion, you do get some micro damage to the muscle. But with an injury like this, so in that case, you absolutely start mobilizing right away. But, let's say we do have a tear. So I'm using kind of worst case scenario.
Yeah.
we want to start mobilizing it like that, but not loading it so much, as far as not actually using the muscle itself. So it's called it's passive. The muscle's being passive, but it's still being put into a stretch a little bit. Okay. And you kind of let pain and then that spasm kind of guide you. And slowly over the next week, I was able to open up more and more and more. So I was able to open up that space between my hips, like
once a day. You're
no, I was doing it as much as I possibly could, because it's happening all the time. So you want to continue to give it.
Anytime you had just a moment, you just kind of pop down and just do a few.
Trying to open it up. Or I would get in the hot tub where everything's more weightless and just start opening, nice and slow, to the point where I could get that thing almost, not quite, but almost to a full stretch over the next couple weeks. And once that was in place, then I started doing things like trying to activate the muscle itself with some really gentle, what we call isometrics. Anybody not familiar with isometrics, it's basically like if I went to a wall, put my hands against the wall and tried to, bench press the wall's not going to move. Right. And let's say I didn't, but I don't want to move either. I'm just generating force without moving a joint. Right. I'm just pressing. The same thing here. In my case, I put a little yoga block between my knees and was doing gentle squeezes to my tolerance. Okay. So to recap, I mobilized it till I could get a good range of motion. And I could stretch that tissue, not stretch, but, I'm not actively stretching, but I'm moving it through.
Stretching for that moment.
For its range, right? Then I would, once I could do that, then I started activating it first with isometrics. And that's really important. Isometrics are very safe and they're very effective because you're not changing the length of the muscle in other words, to give an example of the bicep again, if I held a weight in my hand here at my arm at 90 degrees or push my other hand here and just pushed as hard as I could, like you and Andrew were arm wrestling. A lot of that was an isometric load because the arm itself wasn't shortening or lengthening. Okay. So that isometric is really safe, and you can activate a lot of muscle motor units from that perspective. So that was the next step to do. And so that helps it even more as it's laying down. It also gets the brain back in the game for activating it again. Because one of the things that happens during a injury is the brain loses a lot of its position sense, like where the joints are in space, whether it's contracted or lengthened. The brain can usually keep track of all that, and it loses that. So you want to reestablish that as well. But you also want to reestablish the ability to activate it again. And isometrics are a safe way to do that. Then what I would do, you can imagine I would get a larger and larger object to kind of squeeze between my legs. So I'd open it up, lengthen the muscle more, and then do an isometric. Then at some point it would be a big exercise ball, right? Where I'd have my legs really wide apart squeezing.
A large dude from the truck stop.
Well, put them in, hey bro, I want to put you in closed guard to do my isometrics, right?
Come here in between my legs, buddy. Old Bobby.
You went there quick, too. Was that example right on the top of your head there?
Well, let's just be honest. You teed me up for a bunch this whole time.
I did.
And I kept my mouth shut.
Especially okay.
Lengthening,
I got it.
Whole bunch of stuff.
Okay. And you were good and you didn't say anything. You just went, okay.
I gave Carrie a side eye, but she was paying attention to you rather than my stupid face. So.
I was thinking about my own stupid face.
Yeah. She wanted to jump in and be like, oh my gosh.
So many comments.
Yeah. Okay. So you got a big dude in between you.
Right. Or cut two.
Yeah.
But the whole idea is to then do an isometric at different lengths of that muscle, right? Then I would start doing what we call, once that was good.
So isometric different lengths. So let's say if you're opening, you're on your side.
Yep, opening.
You would be right here, and then.
Yep. And at this point, I wouldn't even be on my side because I got on my back, like exactly, and I'm squeezing in.
But it's not like an actual motion. It's just right there
at that point. Whatever that that distance is. In this case, a yoga block's, about 12 inches.
Then a medicine ball, and so you're just
Progressively. So what it's doing then is it's lengthening the muscle progressively, and I'm doing an isometric at that length to kind of reprogram all those little receptors called muscle spindles in there so they're not freaking out. And they were at first. Every time I'd try a new one, it's like, boom, it'd go into spasm, and I'd have to work through it. But then after the isometrics felt good, then I actually moved into what's called concentric contraction and eccentric contraction. That's just fancy words for, like, if I'm doing a bicep curl, the concentric is the closing, where I'm bringing my hand towards my shoulder during the curl. And the eccentric is known as the negative, right? It's a lengthening activation. So then I would start doing both of those. This is all during this kind of proliferative phase, as the fibroblasts are laying down that connective tissue, so it's laid down as it's supposed to, and it's giving a good direction to do that. And it's also creating an input to create some strength in that structure of the healing muscle or tendon. And then during that time also, I was using some, on the what I'm holding up here is, this is kind of a soft tissue mobility tool. In the therapy and rehab world, it's called instrument-assisted soft tissue mobilization. Fancy word for, scraping, and probably seen these type of things. I was doing this also in the line of the muscle, also providing some input.
Give me a couple.
Yeah, you want to scrape?
Give me a couple scrapes, bro.
Yeah. So, but usually it's lubricated.
Really?
Yeah.
With what?
Coconut oil or something like that. They actually sell some lubricants.
You want to spit on it?
That's the field expedient method. Just Carrie's over there like, I can't
hawks one from over there. Get it.
So, but again, it's another input to provide a directional force for that. And it also stimulates that connective tissue. It helps strengthen it as well too.
And you're just going to use something like that right wherever the area is.
Yeah, and you try to do it in line with where the muscle fibers would go, right?
It's not I know you can get precise tools.
Yeah, and I do have them.
On this that we're talking about, would we not do some of those precise tools?
Well, and those can get really expensive too. It depends on what you're injured. If a tool like the one I have in my hand here, those of you listening aren't going to be able to see it, but it has various, kind of shapes to accommodate different areas. Some smaller ones on one end.
Like the handle of a knife or something.
That's exactly right. And so, it's meant to be like a kind of a multi-purpose one, but they do have, like you said, they do have some very specific. We have a whole set of them. Yeah. So, the point is, we're really trying, instead of immobilizing and to like, okay, you need to rest that thing, we're really trying to give it some guidance to rebuild something stronger. So not only is it laid down correctly, in a line, but after the injury is healed and you're back to doing what you're doing, it's going to be stronger and more resilient. So my goal was to make this, not only rehab this, but make it even stronger than it was to prevent it in the first place. And that's where, I'm working a ton on that, specifically that adductor mobility right now. I'm still working it, trying to, work my way to the splits and all that, which I've never done in my life. And so I'm going to be more resilient for that. Now, during the tissue remodeling phase, like I said, this can last for, months to years. What's happening during that time is that previous collagen, remember I said it was a different type of collagen? It's kind of like, here's the initial coat. Like, now we're going to go back and we're going to rebuild that thing to as much as it was before, right? With type 1 collagen and stuff like that. So it's really important, if you've had these tendon injuries or muscle injuries, to keep working this thing as part of your daily routine, because it will continue to remodel and you can make it better and better over time. Even now, so it's been 10 months since I injured it. And I was back to not just training, I was back to actually rolling in 8 weeks after that. So 2 months, which was, if you go ask your average doctor, they're like, oh, you're going to be out for 6 months with this thing, right? And I was back in 2.
Yeah.
Of course, I had some other things that I'm going to talk about too that were very helpful. That luckily I have a talented spouse who's kind of up on all regenerative medicine, and we'll talk a little bit about that too. But let's move on to something. So that gives you guys an understanding of kind of how those three phases, how it happens, and the importance of early mobilization. Now, have you ever been told, like, hey, you just hurt, gosh, I just pulled this muscle or tore something, and people were popping ibuprofen?
Oh, yeah.
Okay. That's a real problem. It's a big problem.
Why are you looking at Liv?
I think she popped an ibuprofen a day.
So, wow.
Why you
Diamond.
calling me out?
I'm
I
talking.
gave you one too, so
I did. I'm high on ibuprofen right now.
Dude.
Can you see it in my eyes?
Yeah, I'd hate to see you on real drugs. So, you remember, what do they call the first phase of this? The inflammatory phase, right? And the remodeling phase. Yes, it will help with pain, but you're interfering with that inflammatory response that is absolutely crucial for this healing. So you're going to have a short-term benefit by taking ibuprofen of maybe a little more comfortable, but that's not going to repair well. You're basically inhibiting. It's like hiring a work crew and then, getting them all drunk, right? They're just not going to do a good job, right? So, matter of fact, in sports medicine anymore, especially during the acute phase of an injury, during the first, even up to a couple months, the recommendations are stay away from that stuff. Okay. I'm talking about
ibuprofen.
Yeah, and I'm talking about whatever in non-steroidal anti-inflammatory drugs. Ibuprofen is just one of them, right?
What are a couple of those? Because
Naproxen. Okay. There's all kinds of prescription ones like diclofenac.
Well, like the stuff that would be in our cabinet.
Yeah, like usually naproxen, which is Aleve.
Okay.
Ibuprofen, which is Advil.
Yeah, let's use the generic names for sure.
Yeah. But I mean, there's ibuprofen. You can get it in Advil, but it's still ibuprofen in, Motrin, right? Those are both ibuprofen. Okay. So that's why I use the generic terms instead of those trade names.
Yeah.
Because they can be different names and people get confused.
Yeah.
Aleve is naproxen. So any of those non-steroidal anti-inflammatories are a no-go, and you absolutely shouldn't use them during an injury like that. Now, if you're using it for,
they might slow down, or they will slow down.
They will slow down the healing. And matter of fact, not only will they slow it down, but that repair is not going to be as strong.
Is that the same with, once again, not very serious issue like what you had, but even muscle pull?
Yep.
Slight tendon damage.
Exactly.
Okay.
Yep.
Wow.
Because it's all on a continuum of damage. It's just that one that I had was, very visibly bad, and with the bleeding and stuff. But all these things involve some degree of that damage. Right?
I didn't know that.
Yeah, a lot of people don't.
So is it you just want to avoid those NSAIDs like for the first week or two, or is it it's for the entire time?
Yep.
Okay.
So just don't have them.
Yeah, I personally think those are a way overused medication. They're not benign medications. They have all kinds of problems associated with them. There's time and place for everything, but people take this stuff like it's it's candy all the time. Like, I get it if you have a headache or something like that, sure.
But even then, if you're taking 4 a day because you got a headache.
Well, but I mean, I get it, right? But it's specifically for these injuries. It's not a good thing.
See, he said he gets it, Liv. He gets it.
Okay. Well, the recommendation is 1 pill, and you take 2 or 3 at a time.
Well, it depends on what you're taking.
Thank you.
The max dose of ibuprofen is 800 milligrams 3 times a day, which is a lot. So most of the things
400.
Most of the one.
24. Oh.
Yes.
I just do that once.
Yes.
One shot.
That's what I'm saying. He takes large sums.
Are you buying it over the counter?
Well, not ibuprofen. He does it with Tylenol.
Yeah.
Okay. Most over the counter ibuprofen is 200 milligrams per tab.
Yeah, and I take 4.
Yeah, which is the max dose at once is 800 milligrams.
Get off my grit.
Why are you taking max dose?
'Cause I'm a maximum kind of dude.
Okay.
Well, it's why it's why his tendons and ligaments are so weak. No, but that's a yeah. I tried to.
I'm literally
And
I think he was trying to sweat you out.
You can keep talking.
okay. Bill's
Where are you
leaving.
going?
I'm out of here.
So just unplug it, man. Yeah. So that's a really important point I wanted to make because a lot of people do that all the time, and I don't blame them because they were taught that, right? They're like,
sure.
oh, just ibuprofen, and guess what? You do feel it relieves some of the pain associated with the inflammation.
Is there maybe a placebo thing though? Also, like it's maybe like yes, it works to a certain extent, but people get to the point where they're like, okay, I'm going to take this ibuprofen, I'm going to feel better.
There's always a placebo with stuff. It's always a component. There really is. And there's a nocebo too, where you think something's happening to you that may not be happening, and you'll have real effects from
It's
that
a real
too.
word, nocebo.
Nocebo, yep. Yeah, I can tell you a story about that. It's really interesting, actually. But I digress.
Yeah.
So that's a really, really important point. Now, ice. People are going to ask about that.
Mm-hmm.
There are a lot of camps. There are two main camps on that. It also is anti-inflammatory, but not systemically so in your body. It will be more local. There is some evidence that it also can impede in the early stages, healing. I'm not as strong on that as I am the ibuprofen though, because you're not getting the sledgehammer effect of the ibuprofen. You're getting ice for maybe, I don't know, 15, 20 minutes, right?
Mm-hmm.
It can help with the swelling acutely. There's not a problem, but it's not something I do routinely. If I really wanted to optimize my healing, I would do some, try to minimize it as much as possible. And some compression too. So we're going to talk about that. Heat can be a little rough at first during the acute phase. I usually do heat when we're into like phase 2, when it's the proliferative phase, to kind of get blood flow into the muscle. It's because what we want with that. But you can, what I recommend, especially, early on when there's a lot of swelling, you can use compression like an ACE wrap or something like that, but you want to wrap it from, so for instance, if I had like a ankle sprain, I would wrap that thing from the end towards the body. You don't want to wrap it to kind of keep you want to kind of milk the swelling, so to speak, towards the core of the body. In other words, going north, not south. So on an ankle sprain, I'd be wrapping it from the ankle up the leg, not the leg down to the ankle.
Okay.
Does that make sense?
Yeah.
So you're kind of using it compression that way. And you can, in the very early stages, the elevation certainly could be helpful. There's not a whole bunch of evidence.
What is that doing, the elevation?
So you're basically, you've seen when people will sit for long periods of time with their legs down below, the gravity itself will kind of pull fluid down. People that don't have good veins, if they sit for a long time, you can see they have ankle swelling.
Okay.
Over time,
It just helps with swelling.
Yeah, that's all it is. You're using gravity basically to kind of move it away from the extremity a little bit.
Can I ask you something?
Yeah.
What makes someone not have good veins?
What I mean by that, they usually have a pathological condition. Typically, you see that a lot in diabetes. You see that in where they have hypertension's another one, high blood pressure, where because you think of what veins have to do. They have to return deoxygenated blood back to the heart and to the lungs so they can get oxygenated again. That's what veins do. They carry kind of the red blood cells have already had their oxygen stripped from them, and they're carrying it back up for more. So veins often have to go against gravity too. And the higher the back pressure is, it's having to push a lot more against kind of upstream. And veins have little valves in them. They can become incompetent where you're just not getting good drainage again. And so it kind of builds up in gravity-dependent places. Like if I'm sitting for a long time, my ankles will swell because they're hanging down.
So you have someone that is just chronically stressed. They're just a stress ball,
Mm-hmm.
and they get a lot of swelling in their ankles. Could that be related in some fashion?
Yeah, not
Connecting two things.
well, not in a vacuum,
Okay,
not in itself. They probably have other stuff going on contributing to it.
more so than that.
Yeah, for sure.
Okay.
You know, if you have ankle swelling for no reason, all of a, you know, that needs to be looked at anyway. You know, so but my point is that whole rest ice, you know, the compression elevation is fine, but we want to mobilize early. We want to provide those lines of force to have the repair mechanism kind of start laying down. And everything's going to be a little different. Like for me, what those exercises look like are completely different because it depends on what part of the body's injured, right? You know, my adductor muscle was torn, so I had to kind of like, okay, well, you know, what exercises do I do to, you know, to do that? And it's different for every body part.
Okay.
Yeah, but those are general principles on that.
Okay.
Now, the last thing I wanted to talk about, what I think, and there's not a whole lot of research, but it's an emerging area. When I say not a whole lot of research, I mean compared to the, you know, thousands of papers on kind of well-established things. There's a new field of regenerative medicine. You may have heard of like platelet-rich plasma, otherwise known as PRP, exosomes, stem cells, and some peptides.
Rogan's probably made that like really popular.
Well, and Carrie happens to be very well trained on that. So a couple things she did for me, and for those of you listening that kind of want, you know, that are interested in this stuff, you really have to find a doc that's trained in them because most aren't.
How do you do that? Because from my knowledge, it's a little. It's new, so
You can look.
restrictions
Regenerative medicine is a good place to start. People that do that. Carrie, do you have any? You can just yell at me. I'll repeat what you said. Do you have any like resources?
There's the International Peptide Society.
So what Carrie said is
Providers there.
Carrie's trained under the. Are you trained under them too? You're trained under Dr. Seeds, right? The doctor she trains under is kind of one of the world renowned experts in peptides, and we'll talk about that here in a second. But she said the International Peptide Society has a list of providers. Excuse me.
You
But
just look for your area.
Yeah. So what these things do, like she gave me exosomes, and I'm not going to go deep into any of this stuff because that's a whole regenerative medicine's a whole podcast. But basically, they serve to kind of enhance your body's natural stem cells coming in to help rebuild things. That is a terrible explanation, but it's really complex, and people would just turn this
I
off.
think
And
we've talked about doing an episode, right? Yeah, which
would be really good.
Yeah.
She also gave me this peptide called BPC 157. We did injections on that around the area, which also helps to enhance that whole healing process. Really cool stuff. And I feel very fortunate because, I mean, I like I said, I was training and drilling again probably at 5 weeks after the injury. But I was actually rolling again, sparring at 8 weeks.
And the only trade-off with that
BPC 157?
was the whole hairline issue, right?
Oh, you're saying I lost hair because of it?
Well, I'm not saying you lost hair. I'm just saying,
Dude,
you're like I think the word is receding.
it's in full retreat.
Right.
Okay.
Now,
And-
he won't let me inject his scalp. It helps with hair growth.
Oh,
So Carrie just said that I won't let her. I just haven't crossed that bridge yet.
So if you let her stab you up in the brain, it's going to actually help with
It.
that
She
issue.
does a lot of matters. Some of her patients see her for hair loss.
So when she injected you for your boo boo in between your legs,
Mm-hmm.
the receding thing that wasn't related.
No.
Oh,
I find it ironic that you're talking to me about receding hairlines.
why?
No, because I can see my reflection in your dome.
The Lord blessed me with a very nicely shaped head.
You actually do have a very nicely shaped
and
head.
he just wants me to show it.
Carrie actually has told me that she would like it when I
She
actually
admires the shape
she-
of my head.
no, mine. I think she would. I don't know. Maybe she does.
I think you got a pretty good bean on you.
You think I do?
I do.
Think I can pull it off?
Because in this light, I can see pretty deep in that scalp.
Yeah, it's gonna be a.
Pretty good
I would
shape.
say its days are numbered. I think you and I are gonna. We'll be the.
Yeah.
Yeah. We'll.
Unfortunately, I was looking like you at about 22.
No.
So I didn't
That's
have
all right.
much of a choice.
That's all right. You're pulling it off.
You
dude.
keep it though.
You,
Keep it. I can't stop looking now.
I'll keep it until you're like, okay, man.
Yeah. It's
As
when-
a friend,
right.
okay, you would tell me, right?
My alarm that you're talking about
Mhm.
was when I was letting my hair grow.
Mm-hmm.
I let it grow a little long,
Mm-hmm.
and
Skullet. You got to skull it.
It wasn't necessarily a skullet because I hadn't shaved my head yet.
Oh, okay.
Because once you shave your head, you can't go back.
Yeah.
It's done.
Right.
You're going full George Costanza at that point.
Right.
But I was walking around an elementary school and they called the cops because I looked a little,
Yeah. Uh huh.
stereotypical.
And at that point, you were
I
like,
was like, oh, this is probably a bad deal.
were you driving a panel van?
I wasn't. I was just walking around.
Oh, really?
Yeah.
No ice cream.
I mean, I had ice cream on me. That's just always stay strapped.
Ice cream with a trench coat.
Yeah. So that was my sign.
Okay. Well, you will intervene when the time is there.
100%.
Okay.
And I will let you know it's not a joke. It's real.
You'll tell me.
Real talk.
Okay.
Real time.
I really appreciate that.
Mhm.
That's what friends do. Or she can inject my scalp and
Why don't you inject my scalp? Or am I a little too... Science is not that good.
yeah, that's what. For those of you that can't hear what Carrie said, yeah, she basically says, there's sometimes we just, you got to put it out.
I've accepted my fate.
No, it's all right, man. You're pulling it off great. Yeah, so that's kind of the some of the general principles. You think that was that helpful to you as far
Oh,
as
for sure.
kind of those are the big things. That whole let's just rest and
Well, it's against literally what I remember learning, that rice thing that
yeah,
you're talking
exactly.
about. That I literally remember learning that. And that's why I also remember when Russell Wilson did his thing,
Mm-hmm.
why it was so different from what we're told. And then
That's
I know
right.
when I've had little tweaks here or there, you've had me run through the CARS
Mm-hmm.
system when I've had bicep connection issues or shoulder issues or something like that.
All that stuff that
Yeah.
we got from the FRS,
Mm-hmm.
that group, that is all about tissue remodeling.
Mm.
Yeah, they did such a wonderful job with that. I can't even tell you. You talk about up on the research and stuff.
Yeah.
So it's really, really important because you'll hear even today, they'll still doctors and other therapists that don't keep up with this stuff will still parrot the same kind of stuff.
Yeah.
People that are following sports medicine literature will know that about this.
Yeah.
So it's just good to know. And again, if you're worried about something, please go get it checked out. So at least you know what you're dealing with. Okay.
Mhm.
If you don't have a medical background.
Right.
Yep.
We do have some questions
Yeah, that'd be great.
that we want to go over.
Cool. Do you have any questions about Olivia and about anything I just did?
No, I think I'm good on that.
Okay.
Yeah, you were very clear.
Okay.
I like
She's
that.
like, no, I don't want to talk about it anymore.
What do you got?
Okay, so first one, this is from a concerned friend.
Okay.
Says, my question is, why does Chris's lisp become more prominent when excited or nervous? It sounds like he might be grappling with his hardware.
Well,
So,
talk about just a friend being bold.
well, this friend, I actually know who this is
Okay.
because they thought they would need to come and tell me about it first. Instead of just throwing it on the podcast.
They said they're throwing some heat at you.
Well, those of you that belong to our academy, this is a hobbit-looking individual,
Hobbit.
very much so.
Big feet.
Big feet,
short in
very
stature,
yes.
Hairy feet.
Well, I think she took, and it's a she. She took care of the hair on the feet, but they're really creepy and dexterous feet that she uses like hands.
Getting a
So,
good visual.
uh-huh.
Okay.
And is a black belt.
Wow. Okay.
Likely due to her hobbit-sized stature and her ability to use her feet.
Wow. Okay.
So, should really hurt my feelings on that one.
Can you address the question though? About your
It's
list?
probably true.
Okay.
And it's probably because of the bunch of hardware I have in my mouth that I'm
Yeah.
really self-conscious about now. Thank you very much.
Wow.
She may have also played a teenage witch on a television show,
Okay.
if, putting the pieces together. So,
Right. Well, this is.
you know who we're talking about.
Wow.
Oh, very
Yeah.
awkward.
Yeah, it's a little sensitive, aren't
You
you?
can tell I thought about this a long time. Too. By the way, that my speech impediment was worse when I had the expander in too.
Oh, yeah,
it was rough.
It was brutal. How much longer do you have?
Probably another year.
You're giving me good 5G signal though. Every time I'm around you,
I know.
my Wi-Fi is sick.
Yeah.
Get us another question.
Okay.
No more insults.
No, it's fine.
Okay, well, let's talk about this then.
Okay.
How long did it take you to put that shirt on?
What, this?
Yeah.
About 2 seconds.
That's what I was thinking. It was.
It's
Yeah.
not a medium. It's a large.
I didn't know Rogue made kids' clothes. So, if anything, it's nice because I can get Eli a gift for his birthday. He just had his birthday.
Eli's bigger than me.
That's true. And you're wearing a shirt that was made for him.
No.
And he's 12.
Hilarious. I'll have you know this is a large. And we're talking about the guy that
In Japan.
wears. Let's talk about your rash guards, your sleeveless rash guards.
Talk about him, bro.
Yeah. I'm just saying, if we're
I'm
going
putting the whole gym on notice.
So now I could understand if there was if this was super tight around my waist here.
Uh-huh.
I don't know what to
tight around your bosom.
I can't. I know.
Okay, just wondering.
It
It was just a question. Don't get defensive.
I feel like I feel attacked.
Okay,
You're just mad because Andrew is feeling my arm.
shut up.
He was getting jealous.
I'm assuming
I
so.
flexed for him this last time.
And he dismissed you, so
A little bit.
yeah.
He took a stripe off. It was weird. What do you got?
Okay, you ready?
Yes.
Okay. So first question is on hydration. And this person says, how do I determine how much sodium potassium I need to replace? I sweat like a pig, even during light drilling. And by the end of the session, I feel like I need 2 to 3 bags of element or liquid IV to properly rehydrate. But when I see that each bag has 1,000 milligrams of sodium, I think I'd have a heart attack if I drink more than one.
No, you're in a way to also tell how much salt you can. This is gross, but if you're the one, if you take like whatever shirt you were wearing and hang it up to let it dry, let's say your rash guard, many of us will see like a kind of a white coating. My point is we lose a ton of salt. And if you're sweating like a pig doing jiu-jitsu, you're not in any danger of overdoing it. There are some people that take up to 5 grams of sodium afterwards.
How much is an element?
1 gram.
1 gram.
Mm-hmm. And you're losing a ton of salt if you're sweating a lot. There are formulas they've come and they say, well, you can calculate how much, and there's a sweat test you do and all that. But honestly, if you're doing 2 to 3 packs of element, I'm not sure how much liquid IV has in, but if let's say you're doing 3 packs of element, it's 3 grams of sodium. You're not going to have a problem. And those also, they don't have high amounts of potassium in there.
But he's going to want to mix that with, like, not just a 16-ounce water.
Yeah,
right?
exactly. Like, for instance, here's a perfect example. I have a 64-ounce container here, and I have it filled with water, and I have 2 packs of element in there. And that's from rolling today. I'm basically trying to catch up with I did a full one after. I did a full 64 ounces with 2 elements right after jiu-jitsu. And then I filled it up again and through the rest of the night. So I'll have like 4 extra grams of sodium in there because I sweat a lot too. Right. If you don't sweat that much, you're not going to need to replace as much. But yeah, do an experiment. If you think you're, if you're sweating a lot, go ahead and be gross and just hang that rash guard up without washing it.
And look for the
Let it dry, especially if it's like a black rash guard, and you can see it feels a little crinkly too.
Well, so the question, he was just worried that he's or
A person like that, yeah, I heard he just didn't want to die. He said, a person like that's not going to
he was worried he was taking in too much.
Yeah, you're not going to overdose on that. Now, there's a reason why they don't put a whole bunch of potassium. You can, if you took a ton of potassium, it can interfere with your conductivity of your heart. None of those things have a ton of potassium in there.
Okay.
And the kidneys regulate this stuff super well anyway. You really have to have, your kidneys aren't working right to really get into trouble with this stuff.
I made a joke earlier at the gym when I said, you said something about taking salt, and I said, well, I get 1 gram a day. I was trying to make a joke, like it was a very low amount, like you're supposed to get 100 or something. But then you were like, well, I take 4. So I was like, well, that joke sucked. What was it? But now I understand why, because that's like a realistic number.
It is. You actually lose a considerable amount. And then depending on how you eat too. So if you eat a lot of processed food, you're going to get more salt, of course. You're going to get more sodium. If you're eating pretty cleanly, you'll need even more. So, I mean, you have salt in your food and all that. So yeah, it's really important, especially those of us that sweat quite a bit.
Okay.
Next question. Can training in a warm, hot room actually improve your cardio? If you get used to training in a warm or hot environment and then compete in a colder one, will you be able to perform better? Or is it just going to be a mental gain from grinding in a hot, sweaty room?
That is an awesome question because it's probably a little both. But there is a big thing with heat adaptation. So when the brain gets hot, it kind of puts on that, like a governor on an engine. It's like, hey, whoa, right? The same thing with the acidity we were talking about when we were doing the supplements about buffering and all that. But heat especially, and heat, you can get adapted to heat where you can, over time, function better in heat. And when you do go to a cool environment, your ability to cool your body is better because you've adapted to a hot environment. And you theoretically can push yourself harder before you get overheated again. So there's something to that.
Okay.
Yeah, absolutely. So, when I first, for example, it depends on what you've done in the past. When I first started jiu-jitsu, I was getting overheated and I was gassing because of it. It wasn't because my cardio was sucking. It's because my body's like, nope, you're getting too hot. And I used to be the guy also that had to go outside.
Does that feel different? Like, is there a way to identify that that's why you are gassing or
because I was in good cardiovascular shape. It wasn't when I say first started, I was probably a year in, and I was used to rolling hard by that point. But I still wasn't heat adapted because there's a couple depending on the temperature in the gym, especially if there's a lot of people in there, it gets pretty hot and humid. But I noticed I was gassing. The longer I've done it, I don't have that problem anymore. And now I also do sauna as well to help that heat adaptation. So your body will adapt to that to an extent. And then there is a mental component because it's super uncomfortable. But if you're gassing hard because of heat and you're not adapted, you can probably get into some probably feeling really nauseous and feel like you're going to pass out if you try to push too hard through it. I would just say my advice to people like that would be like, try not to go outside, but just stop what you're doing and take a break, but stay in the gym for a while and just kind of, let things just kind of calm down to work on that adaptation a little bit.
And that person should definitely be hydrating
for sure
with the salt and all that stuff.
Yep. And if
not just water,
right. And, people sweat differently too. Some people are better sweaters than others. And if you're not it's part of that adaptation too. Part of being heat adapted is you'll get a better sweat response too. That's our body's cooling mechanism.
Okay.
Yeah. So yeah, that's really interesting. And I've noticed it myself, and it's really uncomfortable, and it kind of sucks too. While you're like, man, I shouldn't be gassing now, but I'm super hot and, exhausted because of it.
In performance. So I think there was a part of that where
Yeah.
it was would they benefit?
If you're like competing in
Yep.
a colder,
Yeah.
colder one. Then.
So yeah, to that point, then let's say you train in your heat adapted in that hot, and then you go to a place that's cooler where you can even more, kind of release the heat from your body. You'll be able to push harder. In other words, your body will take those higher temperatures better than you would have if you hadn't adapted. So there is probably a performance benefit too.
Okay.
Yeah.
I think there's one more.
Yeah, one more. Okay. What are the top 3 positions to master to become the ultimate mat enforcer boss?
What?
Okay.
That's a good one.
Top 3 positions
Yeah.
to be an
Master.
effective.
To be the ultimate master.
Okay.
Why would you want to be a master enforcer boss anyway?
Maybe you feel protective of your people in your gym, and you are willing to. The thing is, if you're gonna take that on, it's not like a public thing, like really, but you have to be like willing to like fight.
So
So if this person is considering, like, if they see some asshole being a bully, like, just know, like, you have to be able to fight. Otherwise, you're gonna get your ass kicked.
And so you could answer your own question and ask yourself, what positions do I hate to be stuck in?
Mm-hmm.
What are the most punishing things to be stuck in
was
that
gonna
you
say-
would hate
Yeah.
if you were the enforcee?
My first reaction was, you have to get your neon belly game super strong.
Yep.
Because that's, like, I would say, the ultimate chill out position, as in you want to chill someone out.
I just think of Aurelius and his.
Yeah.
Neon sternum even, right?
Yeah. Aurelius showed me what he does for, like, a punishing neon belly.
Mm-hmm.
And it's like a soul piercer.
Yeah.
It just, you watch someone's life leave their body, and you accept it as you're a dementor. You're
I like that.
sucking their
Harry Potter reference.
yes,
I like it.
the life out of them.
Mm-hmm.
And it's fantastic when it's done to the right person.
I think a really tight S mount is rough too. If
Okay.
you really kind of get under that shoulder blade and get up high, like a high mount,
Yeah.
that's pretty rough. I think Casey's Kisagatami
Yeah,
is
scarf hold.
horrific.
Mm-hmm. That's a good chill out position. Like, if you got to just put the smushing on someone. Honorable mention, for me at least, is wrist locks, because they're, in my opinion, the most embarrassing. I got wrist locked today, but it's
I did too, multiple times actually,
okay.
probably by the same guy.
big,
Yes,
freaking
black belt.
sloppy foot butthole, black belt.
I'm not going there with you, man, because he wrist locked me like 3 times today.
Yeah, wrist locked me too.
Yeah, and I like how he does it too. He's like, "Why would I do something else? This is less energy."
Well, you know what he does to me is, after I tap, he looks at me and goes, "What?" I'm like, "What do you mean?" He goes, "What?
Why'd you tap?
Yeah." And I just walk away. I said, "Oh, enough with that."
Actually, something that you've had me in before that's pretty horrific. That taking someone's back and putting that body lock on them. That's pretty rough too.
Yeah, that if you can develop the body triangle,
Yep.
that can be alarming. That I get more comments on my body triangle than almost anything.
It's good.
I don't get people in a whole lot because I have shorter legs, but
Yeah, but when you do, it's really uncomfortable.
right above the pelvic bone,
Yep.
in that kind of soft spot, and you just
Where they're trying to breathe and yep.
and just like when you're finishing a triangle, one thing I like to do is like
I know what you mean.
You're-
Internally rotate them.
yeah, you internally rotate both your knees,
Yep.
or hips, I guess.
Yep.
And that actually helps get a little bit more tension.
Oh, yeah.
So it's not just like pulling down. It's actually like you're squeezing your
I
knees
think
together.
last year sometime you had me in one of those things for like 4 minutes. And it was,
I forgot
you know,
who it was. Someone told me they felt like their
Yeah.
organs were failing.
yeah, it ain't fun. It's not fun. Yeah. So
I
yeah,
feel bad. Like, can you actually like hurt someone? you think?
yes,
Oh, okay.
yes.
I don't like that.
Especially, well, you can hurt someone if they are really, if they're trying to twist out of it aggressively.
Could you hurt like an actual like organ?
It'd be
you think?
really hard to do that.
Okay.
Yeah.
So I don't necessarily have to worry about someone like a spleen exploding.
No.
Okay.
Unless you're doing your 5-point death touch.
I mean, you don't take that out for many people.
No.
You know what I'm saying?
Yeah, you got to hold that one back.
So body triangle, heavy S mount,
Yep.
wrist locks, knee on belly.
Mounted triangle's horrible too.
Yeah. Yeah. That one can be tough.
Yeah. So, I mean, those are kind of rough.
Yeah.
I'm sure people can come up with some other.
Oh, yeah. But I'd say a couple of those controlling positions there. I mean, having a solid cross collar choke is kind of nice.
Yes.
Because you'll just throw that on, especially if it's a newer person that's just being a spazzy, like very kind of dangerous. You throw that sucker on, and then you whisper in their ear as you're choking them. That's kind of nice.
You get way too much pleasure out of this.
I do. I'm a piece of shit.
Yeah.
I get it.
Are you looking at me like you whisper in my ear while you do it?
Hey.
Okay.
Carrie takes that a little further.
Yeah, she does. She
You've
puts
seen
her
that?
tongue in your ear.
Yeah. And it's like, you could DQ people for that.
Yeah.
She bites my foot.
Right.
Yeah.
Yeah.
Anyway.
Okay. I think that's it.
Excellent.
Right.
Yep. That's all the questions.
Do some comments on our stuff if you can.
And as Bill said, give us some stars on iTunes.
Star us up. Yeah, comments go far for the algorithm, and liking and subscribing and all that good stuff.
Yep. Keep sending good questions too. Those are great.
Yeah. Thanks,
Except for the Hobbit.
except for the Hobbit.
Yeah.
Hit it.
All right.